Now an update on the worsening crisis in nursing homes around the nation. More than 4,500 long-term care facilities have now reported cases, with the number of related deaths closing in on a tragic milestone of 10,000. That is according to state health agencies that responded to requests by NBC News. But not all states responded, meaning those numbers are almost certainly an undercount. Joining me now is Katie Smith Sloan, President and CEO of Leading Age, a national association of nonprofit organizations that provide aging services. Katie, thank you so much for taking the time to join us this morning. I'm curious to get your thoughts as we're talking about the numbers coming out of these facilities. Why is it still so difficult to get a sense of what is happening inside long-term care facilities around the country?
Well, nursing homes report what's going on in their facilities, cases and deaths, to their state and local health departments. So there is a source of that information. But nursing homes, they're like no other setting in our healthcare system. They're a home, and they're a home for frail older adults, often who have multiple comorbidities and often are living with dementia. And when this virus first was reported, we knew that older adults and those with underlying health conditions were the ones who were most at risk. Those are the people who live in nursing homes. So right away, we should have targeted resources to support our nursing homes. Right now, they're facing huge shortages, inability to get access to PPE, for example. So we've left them to scrape and scrounge and improvise to get PPE to protect their staff and their residents. And I'll have to tell you, a plastic poncho or a plastic apron is really no substitute for a gown.
Can I just ask you really quickly about that point? Why do you think we failed those communities and those homes? Why did we not have, if they are part of the healthcare system, why did they not get the equipment that they needed?
Couple of reasons. One is, as a country, as a society, we have long undervalued and underinvested in services for older adults. We're really not given them the attention, the resources that they need. Second is that we're second in priority for testing after hospitals, and have been for PPE as well. And that's just wrong. We work together with hospitals. We take admissions from hospitals into our nursing homes. We ought to be getting the access to the same equipment and the same testing.
Yeah, let me ask you really quickly about what other urgent needs that these providers have that are going under the radar. You raised the question about PPE. Is there anything else that they need that they're not getting?
They're not getting access to testing. And we need testing with results that come back right away. And that's a significant problem because, as you know, there's so many asymptomatic cases. So it's hard to know who actually has the virus and who doesn't. So we can't isolate residents. We can't send staff home without knowing actually who has the virus or who has survived the virus and no longer has it.
All right, Katie Smith Sloan, thank you so much for joining us and helping us put a spotlight on this.